Kiran Kaur. My student ID is 1093222248. Today I'm going to do the sterile dressing change video. So here's the 360 of my room. Okay, I'll start my procedure. Hi, Mr. Smith. How are you?
Hello.
Okay, so I'm just Kiran Kaur. I'll be a nurse today. So doctor has told me to do your dressing change. So is that okay with you?
Yes.
Okay, perfect. So I'll be changing your dressing. So would you mind telling me your full name?
Smith John.
Okay, perfect. And then what's your date of birth?
0 January. 01 January 2001.
Okay, perfect. That matches with my records. Okay, so before doing the procedure, I have done my hand hygiene. I have given privacy to my patient. Okay, so Mr. Smith. So I'm gonna do the dressing change for you. So before I do it, I have a few questions. First, do you have any kind of pain around the area?
Yes, a little bit.
Okay, so we have a pain scale which says 0, 5, 10. 0 means mild, like very little pain. 5 means moderate, like medium kind of pain, and then 10 means severe pain. Do you mind telling me what's the pain level?
0.
Okay, so that means you have a mild pain. Perfect. So do you want to take any kind of medication for the pain?
No.
Okay, perfect. And then last question, do you have any kind of allergies?
No.
Okay, perfect. Okay, so before starting the procedure, I have to make sure the patient doesn't have any kind of allergies. You have just a mild pain. So I'll start my procedure. So before doing it, I'll make sure everything is in like easy peasy things. I have done my hand hygiene. Okay, and then I've given privacy to my patient. I have adjusted the back of my patient. I've given my body mechanics. I have repositioned the patient. Okay, so as I have done hand hygiene already, so I'll give the blue sheet under the wound area to make sure there is no spoilage of anything. Perfect. Okay, and then I have already made garbage bag here, which I'm going to use while doing the procedure. I already took 4 tapes to make sure that I can secure the dressing afterwards. I have a little piece of tape as well to write it down the date and time for the dressing. I have all the things already here, so next I'm going to do the dressing. I'm going to open my dressing tray in an aseptic technique. So the first swab goes away from me. Second swab goes away from me. Third swab goes away from me. And then fourth swab towards me, but I can adjust it this way. I will manipulate the supplies according to my reach. This is the sheet. I'm going to use this one. I have 6 2x2 gauzes to clean the wound and then to dry the wound afterwards. I have 3 4x4 which I'm going to use to do the dressing for the patient. I have these 2 forceps which I'm going to use afterwards for the sterile procedure. So I'm going to put this forceps here, making sure the 1-inch border here. So I'm going to put the Q-tip just to mirror the length of the wound afterwards. Okay, so after my hand hygiene, I'm going to put the clean gloves on to remove the existing dressing of the patient. Okay, Mr. Smith, while I'm removing the dressing, if you feel any kind of pain, you're going to tell me right away. Yeah? Okay. So, as I can see, the wound of the patient is at the right forearm. So let's just take the dressing off. Okay, so while I'm doing, if you feel any pain, let me know. I'll remove it very gently so patient feels comfortable. Okay, so as I remove the dressing, I came to know that the patient having surgery incision which has almost 6 sutures. So patient doesn't have any kind of prolonged discharge, but it does have a little bleeding on it. So that means it's kind of healthy bleeding. So it's a sign of healthy healing of the wound. So there's no significant evidence for infection. I'm gonna just discard it. Okay, so and then I'm gonna check the length of the wound with the Q-tip. So I'm going to use this Q-tip, I'm going to place this back. Okay, I'm going to check the length. Okay, so it's... Okay, so the length of the wound is almost 6 centimeters. I'm going to discard all this stuff here. almost closed. So the wound looks healthy. Okay, so I can see a little arrhythmia towards it as well. So Mr. Smith, I'm gonna palpate the area. While I'm doing it, if you feel any pain, let me know, okay?
Okay.
Okay, so I'm gonna palpate the area up here. Do you feel any pain?
No.
Okay, so there is no significant edema and then no pain patient complains about. That's perfect. I'm gonna remove my old gloves. I'm gonna discard it. Okay, I'm gonna do my hand hygiene. Okay, so I'll pour some normal saline into it to use to clean the wound afterwards. Okay, so Mr. Smith, I'll just clean the wound, okay?
Okay.
Okay, so I've done hand hygiene. I have put a new pair of glove, which is non-sterile. So I'm gonna use this forceps to get another forceps from the tray out. So one forceps here, and then second forceps here. I'm gonna put it here back. Okay, so first I'm gonna clean the wound in a aseptic manner, so I can manipulate the area. I'll dip it inside the normal saline. Okay, scrub a little bit. Okay, so I'll clean the area firstly away from me, head to toe, discard. Second area, I can do, okay, close to me, head to toe, discard. And then third is midline peripheral, that is middle, and then I'll discard. To clean it for the part dry, I'll do the same procedure. Okay, dry, discard, dry, discard, dry, discard. Okay, so for the next, I'll put the clean sterile dressing on. It's up here. I'll make sure everything's okay here. It's not sterile anymore, so I'm gonna put it here. I'll secure the dressing with my tapes from all the sides. Up here. Okay, up here. Up here as well. And then there's other way this way as well. Thank you. And I'll put a little tape on to note it down the time and date. That is at 10 a.m. Okay, so I have noted down everything, and then I make sure the patient is comfortable. I have repositioned the patient. I have put the patient's bed at the lowest level. I have given a call back to the patient. So okay, Mr. Smith, you are done, and if you need any kind of help, you can call me with the call bell. Okay? So that's all the procedure. I'll do the documentation that a patient came with the surgery incision, and then he came for the dressing change. The wound feels okay. It's completely healing. It's closed. The edges haven't came closer, and then the sutures are already closed. The patient has a healthy healing signs, no significant evidence of infection, and patient is comfortable. He's been repositioned accordingly. So that's all. And then thank you. Here's the 360 per room.